What is your personal feedback about Gender Inclusion Summit? What do you feel about the work that's been done?
Oh my gosh, where do I start from? I think when I attended the first one in 2022,
Yeah.
right?
Yeah.
I actually compared.
Hi, I am Fehimba. Welcome to the Purple Diaries, the Policy Innovation Center's podcast series that takes a deep dive into the conversations and dialogues that we had at the Gender and Inclusion Summit 2025. Through the course of this podcast, we'll be sitting down with incredible individuals, people who are impacting the world and changing the way that we see it. Now, let's take a deep dive into this conversation. So ensure to subscribe, like, share, and comment. Hello and welcome to Purple Diary. Such an honor to have you here today.
Thank you.
So, for the benefit of those listening to us, can you just briefly introduce yourself and the work that you do?
Okay, I am Kemi Agbaoye.
Yeah.
I work with Nigeria Health Watch. I'm director of programs there.
Yeah.
And Nigeria Health Watch is a health communications and advocacy organization.
Okay.
We're based here in Abuja.
Yeah.
And what we do really is to advocate for better access to quality healthcare for Nigerians. And we do that through a number of ways: editorial, podcasts, social media, traditional media. But we're also big on evidence-based advocacy. So we do a lot of evidence generation around maternal and child health, primary health care, sexual and reproductive health and rights, etc. And then we leverage our platforms and our methods and approaches to then push those out and engage with governments, broader stakeholders to push for reforms.
Okay. Can we zoom in on probably one or two of the projects you've worked on, around reforms generally and the effect or the influence of those particular projects? Like one.
Yeah,
Fine.
I mean, I can speak about the projects that made us do this with PIC.
Yeah.
So we co-hosted this panel focusing on MPDSR reform. MPDSR is maternal, perinatal, and child. MPCDSR is what people like to call it now. So maternal, perinatal, and child death surveillance and response. So what it does really is look at why women are dying while giving birth. So there are ways to do that. You can do that at facility level, at community level. You do some inquiries. They call them verbal and social autopsies, where you gather the community, you gather the family where that death occurred, and you try to interrogate is a bad word. You try to ask why she died with the aim of learning, not blaming.
Yeah.
And then making sure that it doesn't happen again.
Okay.
So what this does is, beyond looking at the numbers and looking at the data on DHIS, for example, it looks at other, say, sociocultural reasons why a woman might not be able to access care.
Okay.
So in Nigeria, over 50% of women give birth at home.
Oh.
And a lot of women don't have access to skilled birth attendants when they are giving birth. And our maternal mortality rates are quite high. So as of 2018, NDHS, National Demographic and Health Survey, it was 512 per 100,000 deaths. But trust me, that number has climbed. We just don't have a nationally approved data to quote yet. But we have sources like WHO, the World Bank quoting well over 1,000 per 100,000 people. That means 1 in 100 women die while giving birth.
Wow.
Yeah, so we implement these projects funded by MSD for Mothers that tries to push for safer maternal experiences. So essentially, it's trying to make sure that no woman dies while giving life. That's what we like to call it.
Okay.
And MPDSR is one of the ways, is one of the key tools to making sure this doesn't happen. So in other countries, in other counties, even in states in Nigeria here, we've seen how MPDSR has changed, how has reduced maternal mortality rates. So we're trying to push for that. We don't have a regulation, we don't have a law, we have guidelines, we have things that the Federal Ministry of Health, the National Primary Healthcare Development Agency are pushing, but there are gaps. A lot of states still don't mandate for maternal reviews to happen when a woman dies. A lot of the work is still at facility level, and that misses half of the women in the entire country, because half of the women give birth at home.
Wow.
So community reviews, community reforms, that's still a long ways to go. And that's why we thought this, the platform that Gender and Inclusion Summit provides would be a good place to try to push that narrative. So that's one of the projects we do. We support innovators funded by MSD for Mothers that are trying to solve the maternal mortality issues in different ways, looking at quality of care, looking at reducing the top causes of maternal mortality like postpartum hemorrhage, etc., and also non-communicable diseases. So we support them with communications, with advocacy, with advocating for key policy reforms that could strengthen that process.
Okay. So you mentioned that a lot of states are not doing this presently. Now, what kind of policy reforms, what kind of advocacy can be done, to engage, these governments, these states to actually put this in place?
Yeah, it's funny you ask, because that's one of the questions I had for my panelists in the session in the air. So on the panel, I had the MPDSR lead at MPH. So he is the Deputy Director of Health Services at the National Primary Healthcare Development Agency, but he also leads two key initiatives, maternal health initiatives, MPDSR, which I just spoke about,
Yeah.
but also MAMI. MAMI is Maternal and Neonatal Mortality Reduction Innovation Initiative.
Wow, that's a mouthful.
We like acronyms. We like acronyms in Nigeria. I don't know why. But that's why. So just call it MAMI for short.
MAMI
is what this current administration is trying to do to crash maternal mortality rates.
Yeah.
So they identified the 172 LGAs across the country that have the highest maternal mortality rates in the country. This cuts across 33 states. Kano has 18 of those LGAs. So Kano has the highest. Kano alone accounts for 50% of our maternal mortality rates in the country.
Wow.
So we had the maternal and child health coordinator for Kano State Ministry of Health on that panel. We had the acting director of medical services at the Lagos State Primary Healthcare Board as well on that panel, because Lagos is doing some good work around MPDSR. And then we had the MPHCDA deputy director as well. And one of the questions I had for him was, we have a lot of states that are not implementing MPDSR, that are not mandating it. There are a lot of gaps. There are guidelines, there are stakeholder engagement forums that happen, there are technical working groups. There was once a bill that passed, I think, third reading at the National Assembly, didn't get assented by the president. This was from 2020 to 2022. As of 2022, new administration came in. So the rest is history. So yes, what can be done? There has to be legislation, I think. MPDSR needs to become law. Right, let's start from there. We know that people can still not do it, but let's have a law. Let's have legislation that mandates for maternal deaths to be reported, right? For reviews to happen at community level, at facility level. Let's have a law. Let's have it at national level, at sub-national level. This was a clear recommendation from the panelists. But then also, in interacting with them and their experiences implementing MPDSR, one of the things they said is, people don't trust government. This, you can go and watch the video. This is not me saying it. Don't come for me. But there's very low trust in government. And you see this across all health programs, right? So there has to be an intentional push for community engagements to build trust, to get them to understand what MPDSR is, to get them to see the emergency in a woman dying while giving birth. It is an emergency.
Yeah, it is.
There are countries that have declared states of emergency over maternal deaths or maternal health issues in their countries. And that just brings the political push that's needed, right, to quickly address the issues, the root causes, the things that people are not talking about, things that data won't tell you. MPDSR will tell you. So there has to be legislation, there has to be intentional community engagement, trust building. And then one other key thing that came out was the need for capacity building, right? So we have states like Kano implementing respectable maternity care, building capacities, doing group antenatal care, and trying to build capacities of healthcare workers to be able to better engage with women and encourage them to come give birth in the facilities. Because that's if we even if we identify the root causes within the facilities and we fix it, so you improve the quality of care, you improve, infection prevention and control, you build capacity of the healthcare workers, most of them still give birth at home.
Okay. All right. So earlier off camera, you mentioned, that you were present at the first Gender and Inclusion Summit. So that means this is your second. So now, what is your personal feedback about Gender Inclusion Summit? What do you feel about the work that's been done?
Oh my gosh, where do I start from? I think when I attended the first one in 2022, right? I actually compared that one. And I remember when the executive director first reached out to me and said she'd like me to compare, I was just like, oh my gosh, it would be such an honor. Like, yes, 100% yes. And it was one day. It was, I think, from maybe like 8-ish, because there was a pre-youth thing that happened between 8 and 9 up until like 6 p.m. the first thing I noticed was the amount of energy that was in the room and the dedication and commitment and passion that the PIC team brought to it. Like I remember I made a mistake with introducing someone, and Dr. C just was like, "This is what it is called." I was like, "I'm so sorry. I said that. I did not realize I said that. I'm so sorry." You know, so there's a drive, there's passion, there's excellence.
Yeah.
But also, it's how the Gender and Inclusion Summit has evolved over the years.
Yeah.
So they took the feedback from the first one. I remember one of the things that they said, because it was inclusive. All the right people were in the room.
Yeah.
So there were people with disabilities, there were gender type, because there was, for example, there was a non-binary person who actually spoke at the conference that year. So it was inclusive, but structurally, there were some changes that needed to be made. So for example, how do you access the stage? Those sorts of structural things. Yeah. And then by the next one, it was fixed.
Yeah.
And by the because I follow online. I know I said this is my second in-person participation, but I follow online.
Okay.
Next one was fixed. Next one was bigger. Next one was better. And then here we are at the fourth one. So now this one, I think, still as inclusive as ever, much bigger. Yeah. There's a lot of interest in the conference because gender, I think one thing PIC has succeeded in doing is making gender and inclusion everybody's business.
Yeah.
Because I joined online yesterday, I wasn't here physically, and there were sessions that looked at transportation and agriculture and security, like every sector.
Yeah.
And there were, very good speakers speaking to how can you make, for example, the transportation sector more inclusive? How do you cater to, there was a person with disability on the panel speaking to, for example, I can't see, I'm blind. How can you make the public transportation system work for someone like me? Yeah. And it just speaks to what the theme of this year's conference is. Inclusion, new voices. There are definitely new voices here. It's as inclusive as ever. It's big. There's a lot of stakeholder interest and a lot of push and a lot of drive. The other thing I like about this summit is what happens after. There are very deliberate actions taken to push the recommendations from the summit. So there's a purple book. I'm looking forward to that. Yeah. There's all of the other sessions that happen post-summit. So
and there is a purple diaries too.
And there's a purple diaries. I'm sorry. There's a purple diaries, which I'm sitting at right now.
Yeah.
Yes, so there's a purple diaries. So yes. Yeah. I know I rambled a bit, but that just tells you how much I love this platform and what I think it's doing, to the development space as a whole.
Thank you so
keep
much.
It up.
Thank you so much for being on this panel. It was such a pleasure having you here.
Thank you.
I'm looking forward to seeing you sometime soon.
Thank you for having me.
Thank you.